Hello and welcome to Indiglobal Media Network Edge Factor. Indiglobal Media Network Edge Factor brings scientific research based information. Today we are going to talk about COVID 19's rare side effect. COVID 19 has affected more than 4 crore people in India, and the side effects are found in 8% of the population. As the situation evolves in the next 2 years, we are seeing that there are rare cases which are coming up in hospitals. One such rare case has been noted in Manipal hospitals in Bangalore, where there is regrowth of bones in the muscles. Regrowth of bones happens when you have a spinal cord injury, a brain trauma, or acute injuries. Today, we are going to talk about this rare occurrence with Dr. Gopal Krishna, consultant orthopedic and joint replacement surgeon at Manipal Hospitals, Bangalore. Welcome, Dr. Gopal Krishna.
Thank you.
Thank you. Sir, we have noted a very rare case of bones regrowing in the muscles in a select number of COVID patients. So, why is this happening? And which category of patients are we seeing this phenomenon occurring?
This is seen most commonly in those patients who had a full-blown COVID infection with the severity of infection very high and who required mechanical ventilation. And this also compounded by the fact that when they are on mechanical ventilation, they are immobile completely. In the particular case which we are discussing today, the patient was immobile continuously for a period of 2 months. And unfortunately, this happened during the second wave peak. And it was very difficult to give a individual attention to each patient and do physiotherapy. Saving life was a more priority. So obviously this patient who was on ventilator for 2 months was completely immobile. So COVID infection causes a lack of oxygen supply because of the lung infection. That can affect the circulatory pattern to the neural structure and the muscle, which is a trigger point for the excess bone formation within the muscle. This is definitely compounded by the fact that patients are completely immobile for a longer period.
So, given this situation, there were a lot of patients who were on mechanical ventilation and who were immobile for a longer period of time. So, suppose if they did physiotherapy once they were out from the hospital, then does this chance reduce in them?
It is very difficult to predict which patient will develop this kind of complication.